Oxygen is attached to the RBC, and RBC's role is to take that oxygen from point A to point B and leave it at that place. From point A to point B, it's only the RBCs are capable of taking that particular stuff. And here there is a thing called 2,3-DPG where the mechanism comes as such. And now we have a scenario where you have got the lungs, you have oxygen, you have the lungs as such. From the lungs it goes into the pulmonary veins, from pulmonary veins it goes to the aorta, all things as such, passes through the whole cycle. So when we do in a hyperbaric, when we increase the pressures of this particular thing, the oxygen molecules get smaller and gets perfused into the whole body. The kind of the quantitative increase in oxygen occurs. It is more than eight times or something like that. And this is the one which makes your plasma. It is now we have changed the rules of game as such here. When we are increasing the pressures in the chamber, we have changed the rules. It is not only the RBC, it is the WBC, it is the plasma, it is the CSF, it is the synovial fluid. Everything starts carrying oxygen, leaving at the place. So that's the beauty of this particular stuff. The oxygenation increases just because of this application of Henry's law and this Boyle's law. You can always understand this as such. At 1 ATA, if the oxygen molecules looks like that big, it is 2 ATA. We work with 1.3, 1.5 and 2 ATA. We don't go beyond that. The molecule of oxygen is size decreases. It is something like that. The oxygen which is this much big, and in all ischemias, all your problems with the osteonecrosis, you have got blah blah, so many things as such. What is required, what is not going is the RBC doesn't get to that particular point A to point B. So when RBC is not able to go along RBC, no oxygen flow can happen. So if we are able to make the oxygen volume slightly lesser with this thing as such, this oxygen can permeate into all the things as such in a big way. I can always show some good diagrammatic representation on the later side as such. You can always understand this. This is the normal thing what we are breathing, and this is the person who is having a hyperbaric oxygen, where the lungs are full of more oxygen and even the capillaries are full of this particular stuff. And yes, oxygen, we were talking about oxygen carriage and all that. Oxygen carriage, you can always understand with this particular slide as such here, wherein we are talking about there is a hemoglobin in the blood and there is a thing called plasma. Okay, and normal, before when we don't give a hyperbaric oxygen, the normal carrying capacity of this is that red particular part only. And after we give HBOT, it can increase to this kind of volume. It's phenomenal. People say it's more than 8 times as such, and that is the one thing which, yeah, okay. That's the one thing which is giving us the edge. And I don't want to go further into that. I already spoken to you about ATM. It's not anytime money. It's a pressure as such. What we talk about atmosphere and the pressures at what levels and all that. It is said that in Hyderabad also we believe that during our school days we used to think it was 20% oxygen and the rest is nitrogen and all that. Am I right? Air contains 20% oxygen. Still, in the elementary books, in the 10th class level, it is being projected as 20%. And there is a need of correction now. I think we don't have more than 11 to 12% of oxygen at the present level as such, in any kind of setting as such, be it Delhi or be it Hyderabad. And we compare with this particular stuffs. And I'll try to give you what is this oxygen partial pressures. Okay, at sea level, the oxygen partial pressures is 760 millimeters, and with a normal, this is taken as 20-21% oxygen. With this, you take this normal thing, breathe you in, and you get 160 millimeters of oxygen. arterial thing is 100 millimeters mercury, and venous is 39 mercury. This particular thing is the oxygen, partial pressure of oxygen. Whereas when we go for 1.3 ATA HBOT, what is happening is the venous thing is jumping to 58, arterial is jumping to 149, and you have got in this oxygen this particular thing. And when we go for 1.3 ATA with 100% oxygen, the previous one, which I showed before, was no oxygen was added. It was just a compressed air, which was done before. And now we try to give 100% oxygen. You can see the jump as such from arterial 100, it goes up to arterial 632. 6 times more this kind of oxygen delivery system we are trying to focus as such. And if I can go to 1.5 ATM also, because these things are really relevant to the clinical practice. We don't want to go give something very high and cause some problem to the patient. There are some problems. We have to anticipate some problems and work it out. You can just take this example of tissue and lungs as such. When the lung has got lower oxygenation and you have got abundant oxygen supply, there is this particular thing gets into the tissues, and this causes the result as such. Again, this is something like RBCs floating in the blood vessel, and this you got small things which are hyperbaric oxygen, and you see after hyperbaric oxygen, see that white small droplets, things are there, and it is very, very essential in healing the things as such. And so this is what is the basic idea of giving hyperbaric oxygen. There's no rocket science here. We need to just look at every case is different. We did a lot of cases with small kids like autism and cerebral palsy and all that. Subsequently, we started working with diabetic foods. We started working with something called all cancers in the this region, and now we started doing a lot of work with the radiation, pre-radiation and post-radiation. We started working on that, and yes, we do get some problems also. The most common problem we get with the side effects of HBOT is like when you take an air kind of mode as such, you go into the flight, and once you go to the higher altitudes, you start, there is some squeezing. Some people, they have a really problem nagging sensation because of the pressures equalization. It takes some time, and during that time there is a middle ear squeeze which happens, which causes barotrauma, which we call. And luckily, when we work on this less than 2 ATA, most of the people doesn't get into barotrauma. They do get some sensation in the ear, and we ask them to do some Valsalva maneuver. Valsalva maneuver, we try to tell the local person to start moving his jaws. And again, the kind of cases which I get from these people are not able to open the mouth. Some people with fibrosis, there are so many things and all that. We ask them to do some swallowing kind of stuff. We ask them to close his nose and blow the mouth, and immediately that the squeeze, barotrauma squeeze goes off. And very rarely seizures are a possibility. Only in when we go about 3.1 and all that, this is the possibility. And yes, a person having something like pulmonary edema, somebody is having something like pleural effusion and all that, they are absolute contraindications. We cannot give them as such. Somebody, we did try with interstitial lung disease. Interstitial lung disease, again, we don't take someone who is having a saturations of less than 80. We cannot manage that because there will be a lot of things which happen as such there. So what I can tell you is these are some of the approved indications. What was started was before. I can tell you one particular stuff here, what is approved and not approved and all that. What happens is that the kind of therapies which are done in the Western world are mostly insurance based as such. The insurance pays for all the things are here. So they have approved some of the indications, and we work with some of the indications which are called off-label indications as such. Off-label indications are
You have a thing called chloroquine, which is used for malaria. All of us know about chloroquine, how best it is used for malaria. But this same chloroquine can be given for a rheumatoid arthritis also as an off-label drug. It is not written that chloroquine is used for this particular. This is kind of off-label thinking as such. Now we are trying to work with the off-label kind of word, which is called something to remove the calcium. There is an off-label drug which is called EDTA, which is used for removing the calcium. Now we are using for the lot of coronary vascular diseases which have some calcification. So there is a big list. There are a lot of people. I had personally worked with some of the. I can always talk about people working in some real good work, which is something called complex regional pain syndromes. Because in all our doctors who are practicing, we get patients who have pain. Whatever we do, we give them Brufen, we give them Ketorol, we give them something. He or she always complains of pain. So these are the subset of people which is called complex regional pain syndromes, and we can always use this modality, and we can always reduce the kind of morbidity to the patient as such. And there are some things people have worked in lupus, stroke, myocardial infarction, and a lot of things. I was talking to one of the general medicine PGs about this particular thing, about fetal alcohol syndrome and so many other things as well. I'll just tell a word about fetal alcohol syndrome. Fetal alcohol syndrome is one thing which is a person behaves like an alcoholic and he's not an alcoholic. So the thing is, fetal alcohol syndrome, the word has came because this guy starts working in some of the wooden work and something like that, wooden work with lot of solvents and all that, and he keeps on taking a lot of acetone into the breath. We are somewhere, I believe, in this kind of environment with a lot of air fresheners, lot of DOs and all that. We are also trying to stress our liver a lot, and we are ending up having young people are having these fatty livers. We used to think fatty liver was only for diabetics previously. Now I see a lot of people have using these DOs and all that are having fatty livers. So we need to do something for this particular stuff, and you need a concrete kind of stuff. We cannot remove the fatty liver just by altering the diet or something like that. It doesn't happen. You have to do a detox, you have to do an oxygen therapy. We are doing something for the depression patients also. People who are depressed without any kind of reason. Depression is a big term as well. But nowadays I see youngsters coming to us asking about hyperbaric oxygen with this one. It is the uptake which matters, doctors. The frontal lobe of the brain, this doesn't uptake of oxygen properly to the frontal lobe, leads to depression. And we need to improve this. We can always bypass this physiologically by increasing this, using this 10 sessions to 20 sessions. The patients are really, they are out of their problems as such. I told about barotrauma and medullary trauma. I think I'll just go to, yeah. I had put some slides for dental actually. I'll just take I'll just change it as such. 1 second, just give me a moment. I think I had, these people have jumbled up my thing as such. Meanwhile, I can take up any questions because I'll take another 5 or 8 minutes as such. Any questions, I'll be happy to answer. Any questions? By the time I solve this thing, 17th March Dental College. Any things you have not understood, and I can always add some things. I'm sorry for the jumble actually, because I was using my MacBook. I created everything in the MacBook, and I was not knowing that, I was not aware that I thought MacBook may work or doesn't work at all the places as such. I'll just talk about some of the indications which I thought I'll share with you, and I have been working with some people with this one. We had done a lot of cases of osteonecrosis in a big way. Of 8 to 10 sessions of hyperbaric oxygen is definitely causing a change in the person, and yeah, I'll just 1 second now. There is I thought I'll just show you this particular stuff. I can always talk because most of my work which I do, I don't have that pictures and all that of this one. I can show all the diabetic foods and all that, what we have done, what the MRI and other things and all that. I can share that particular stuff. Osteonecrosis is more of a clinical thing as such. You see all the things and you tell us. And most of the clinical symptoms are patients do have that pain as such. That's the number one thing. And patients do have they have a very bad breath which comes out, and we see some whitish thing over the gums, this particular stuff. We see the bone which has come out. So again coming, I'm going to the pathophysiology. Here we are talking about this is the oxygen, diffuse oxygen to the plasma and all that, and this is the blood vessel. Wherever there is a restriction of flow, these things doesn't fill up, and these tissues get ischemia. They start having pain and all that. And with this hyperbaric oxygen, what we are doing is, even if we are not clearing the block here, we are increasing the pressures of oxygen so that these pressures, they start equalizing from here as such. Because it's not the RBC which is going in, it's the plasma which we can, through the plasma, oxygen is entering into all this tissue. And more than that, there are, apart from this particular thing, there happens is a neurovascular regeneration happens, where what happens is that the new blood vessels, they start cropping up, which is called collaterals as such. This happens with the HBOD. This is one of the which improves the microcirculation and causes a different pattern as such. Most of the patients who come to us are diabetics, and they do have problems with the microcirculation. I'm sure your dental patients also will be having a lot of microvascular changes as such. So this is the way hyperbaric oxygen works, and you can always see, this is what I was trying to depict a picture as such. You can see a tumbler here, you have got a normal pressure, you have got oxygen molecules here, whereas with hyperbaric pressure, this oxygen molecules, they decrease in the size, and the more number of oxygen molecules are there in the this fluid. The fluid here is the water, but you have your body is made up of 70% water as such. It's a fluid. Everything is a fluid as such. So when we talk about improving the oxygenation in the vascular system, as well as the lymphatics and other things, you see the phenomenal changes as such. This is how we try to work it out. And last slide I just want to show you is that we talk as doctors, we used to talk about only arteries and veins as such. We were taught during our dissection days also to look at only the artery and the vein. We forget about one thing called lymphatics. Lymphatics do play a major role in the health part as such. So here we try to improve the lymphatics by this hyperbaric oxygen. Lymphatic circulation, if this starts moving, the patient goes to the next level as such. Based on that particular stuff as such. And this is one more very interesting thing. You can always understand, by the time oxygen is in the room air, it goes up to the heart, and from there it goes into the mitochondria. It is only the 0.3% of the inhaled oxygen goes into the mitochondria. And if you are able to improve oxygenation by twice or thrice also, all the mitochondrial cytopathies, the problem is, you see, when we are talking as a big level, it is the mitochondria which has to be catered. If the mitochondria can be catered, that makes a thing. Yes, I got the slides back. So I started using only for that post radiation as such, osteomyelitis of the jaw. And I had seen some startling results as such, because the patient tends to talk to us on the third or fourth day itself. He comes back with a smile and says, "Doctor, nopi takinde." So that without giving that antibiotics, because someone has tried for a month or so, and the moment we get that such thing as such. I can tell you that's the biggest we get that this one. It's an impetus we get, and we keep going on as such. Osteonecrosis is characterized by you all postgraduates. You are aware of this hypocellularity, hypovascularity, and hypoxia. Whenever there is a radiation which causes a kind of shrinkage on all these stuffs, and by increasing the angiogenesis, this is a kind of work which was done by Judy Folkman, where he suggested by increasing the angiogenesis and all that, and it helps in this hypoxic wounds and all that. And I think I had shared that Mark's protocol with all of you, where Dr. Marks has done some kind of work pre this one and post surgeries. We can do some kind of 5 sessions also, because normally people doesn't come to do us with 10 to 20 sessions and all that. This has to be done at a bigger level. But even if we do 5 sessions of that and do a surgery, then after that 5 sessions, the outcomes are much better as such. And most of them, this refractory osteomyelitis, you are aware of that. And we had some interesting cases. I can always just show you some of the things where I can show the work which were done by in the limbs and all that. Diabetic foots, osteomyelitis. We have got osteomyelitis in the femur and other stuffs as such. I don't have that data of this tooth and all that. I don't know how to image that particular thing also. I started thinking about how to take that particular thing, but when we look at the patients, whenever we look at the diabetic foot and all that, everything is outside. It makes a good kind of stuff. Oh, okay, I'll just I'll not take this oxygen other things as such. We do use for all the cases like Parkinsonism. We try to work with the infertility, and I'll just show you some of the cases. I know I am you have to go for the lunch and all that, and we keep doing for a lot of onco cases. Hemorrhagic cystitis is the one we try to work with. Post-surgical brain edema, neck and following throat and neck surgeries. This is one of the biggest kind of lot of papers have been written on this particular case studies as such, and it really works. And when I see that forearm flaps and all that, this works, and I'm sure flaps surgery what you do here, it's also have the same kind of this one. And this is how we started working on this, and I'll just give you a small, I'll just show you how we start. This was the case with, this lady came up with she is over trauma, whole of the calcaneum was cut. This patient is a teacher, and his son, after going through the big Govt hospital, he approached us. He stays in Ohio. And he said, "I want to try hyperbaric oxygen for my mom." Normally, our other doctors, they don't prefer this because they think that this is something, it takes long times as such. We started on the day 1, ma'am, day 3, day 5, and day 12, day 13. Absolutely, patient was such, she keeps still coming to us, tries to spread a positive word about to other patients as such. This lady was told to go for a below-knee amputation, and we had different cases. Some guys having cellulitis and all that. This is a very subtle, easy thing which we feel we can do by just improving the oxygen levels. We don't have to give a lot of antibiotics and all that also. We did some cases where this is one engineering college girl. She completed her engineering. After that she came. She had something like Takayasu's disease, all these 3 fingers, and she was told to go for an amputation as such. and we started our therapy, which consisted of hyperbaric oxygen, and we went to something trying to work with something called PRP. I am sure all of you know about platelet-rich plasma. We try to work on that, and I keep using ozone also a lot. So in this case, I had taken multimodal approach, all this particular stuff, and it was a fabulous result as such. Over a period of time, at least it took me almost I think more than a month as such, and patient also the kind of outcome, the whole thing, Takayasu's disease, where everyone told to go for a amputation, and it was a right hand and right or left hand, but for engineering college student, she's now teaching on something as such. His name is so like that we keep doing a lot of cases about that, and I didn't had these pictures. I would definitely like to work with all of you, and we can we can do some academic studies also, and I think this is all what we are working out here now. And I'll be happy if you have any questions and all that. And this is just glimpse about what is hyperbaric oxygen. You can always visit us whenever you are coming that side. Try to see how this thing works. I think always now I start believing is trying to work. There's not a single modality which works totally. We need to have 2 or 3 things options and start working on that. Because I'm very confident of what this particular steps, and this can be taken to the next level. Not many doctors are aware about this hyperbaric oxygen modality also. We started talking about this in different forums and all that, and people said, is it so simple? I can always show you the kind of apparatus our team is there. We try to work in the kind of thing. We'd like to make it more simpler as such. There's no need for any complicated stuff as such. We don't have. Yes, we do get some challenging cases. We do get some 80-year-old with a asthma. We do get somebody with emphysema and all that. We have to really look at the pressures and work it out. It's not if we are giving something high, it gets into pneumothorax and all that. It causes a real problem. The key is select your patient as a kind of thing, and most of the whatever cases we have in till now, what we are doing, it's a question of it takes, for some people it takes 5-8 sessions, some people take 10 sessions, but there is a change in the outcome as such. You can always. So I thank you, and I thank once again, ma'am. It's a kind of you gave me a chance to come and talk to you people, and yes, I'll be open. If any postgraduates trying to do some kind of work, we'll definitely help you out. You can always pick up your cases and start looking at that. Thank you, ma'am.